Surgeons are currently facing a 3.75% cut due to an expiring conversion factor update that took place at the end of last year. Additionally, they are now facing some items that are designed to curb spending, which are pay-go and sequestration. Together, all of those cuts amount to 9%.
What we found in talking with surgeons across the country is that those cuts could have extreme impacts with regards to patient access to care, delayed surgical care. We're coming out of a pandemic right now, and the reality is we've seen what delayed surgical care means and how that impacts patients, and we don't want to see that happening in the future. So we really need to get these cuts stopped.
The Medicare patient is our nation's senior citizens. They are the beneficiaries that we need to protect, and they are the beneficiaries that were amongst the hardest hit by the pandemic.
The long-term effects of these Medicare cuts involve not just Medicare patients, they involve the entire healthcare system.
According to the Medicare physician fee schedule, we are locked into a budget-neutral payment system. That budget-neutral payment system does not include an automatic update for physician payment, and it also means that when there are increases in one area, there are decreases in another area, leading to cuts to physician payment. We oftentimes have members of Congress ask us to have constituents reach out so that they can hear how it will directly impact constituents at home.
We have some support in Congress, but the reality is we need more support, and we need to continue to push Congress to get this done before the end of the year.
Surgeons need to just take a few minutes. We know how incredibly busy they are. We've made it as easy as possible to write their member of Congress and tell them that these cuts will greatly impact their ability to provide the care that they want to provide to the surgical patient. So they should get on surgicalcare.org.
Surgeons are the most fantastic people in the world, taking care of patients 24 hours a day, wherever they are, whatever they need, in order to make sure that their lives are affected and improved and taken care of. We need to make sure that we can continue to do that. And when I see these cuts for Medicare physician payments and other cuts that we're looking at, we need to get these fixed because patients need surgeons. They need to be taken care of, and we need to make sure and continue to do that every day.
Surgeons are everyday heroes. Whether they're saving lives or improving lives, they are great leaders within the community and within our country, and we need them to have stability and support, especially as we emerge from this pandemic.
The worst case scenario for me right now is that these cuts could go into effect, and we could see patient access to care be delayed, and we could see real problems within the whole healthcare system. We don't want to get to that point. Congress needs to act before the end of this year in order to protect patient access to care.